Now, back to Coastal Living on KZTV.
All right, so we are here today to celebrate a beautiful you, whether you're male or female, with this wonderful woman. Please welcome Dr. Cassidy Hinojosa with Coastal Cosmetic and Plastic Surgery Center.
Yes, ma'am.
Tongue twister, but it's in here, it's there. So today we're talking about a procedure that is friendly for both men and women, scar revision.
Yes.
We can have scars from literally anything. So talk to me about that process, who's eligible, and how it works.
Yeah, absolutely. You know, scar revisions are very common, whether it's from a C-section, another type of surgery, or oftentimes from a trauma where maybe the area didn't heal like we would have wanted it to. And it's not always for cosmetic purposes. Sometimes the scar causes functional complaints. Maybe it hurts or it itches or it's actually prevents you from doing something. Yeah, absolutely. It can be in a sensitive area where it's pulling on something like your eyelid or your lip. And so those patients are great candidates for what I would call a scar revision.
Okay, and what is the process like? Is this something that you use a laser for, or is it always like a surgical procedure?
For most scar revisions, I'm actually doing a surgical procedure where I'm excising the current scar and we're making a new scar with the hopes that it's going to heal nice, flat, thin, and pretty. When we have traumas, you know, oftentimes, whether it's an infection or it's a dog bite, the way the tissue is handled and closed is very different from a nice, clean, fresh surgery, and all of that really takes a part in the way the skin heals and that scar forms.
Yep, absolutely. And it's funny you say that because y'all may have noticed it, have some scars on my nose from where a dog almost bit my nose off.
Oh my goodness.
My nose is hanging on for dear life for a good 10 hours, I think, before I was able to see someone. And I'm fortunate that it happened to be a plastic surgeon that was able to put my nose back together, because the scarring is minimal. But I am still not sure. I feel like I have keloid skin, so I feel like my scar sort of like lifts up. Same with other scars that I've experienced in my life. I have some from my childhood. So is somebody with keloid skin not eligible for this type of procedure, or do we have to take a different care for it?
So I always tell patients who have keloids, and with a keloid, you can have it in some areas, and then in some areas of the body you may not keloid. So the ears are a common location for a keloid after a piercing. Oftentimes the chest is a common spot, not a great area for a scar. And with a keloid, the scar, the definition of a keloid is that scar kind of goes outside the boundaries of the scar. So it just kind of continues to grow. And I tell patients with keloids, I treat them in the same way, but I do kind of closer follow-up. Sometimes we're doing steroid injections, and I always let patients know that if you've had a keloid, you're prone to having it come back again.
Okay. And what type of maintenance are we looking at for anybody who goes in for a scar revision procedure?
So for most scar revisions, I'd be telling patients we really want to wait a full year from the time that scar was formed before we revise it, because it really takes that long for a scar to heal. During that whole year, the scar is remodeling and flattening out, and so sometimes we may think we need a scar revision, and then a year later we find the scar's really healed up nicely. But in terms of care after revision, most important thing for scars, protecting it from the sun, and scar massage. Just the act of massaging that scar can help it to flatten down.
Okay, and is it true that certain products that have like jojoba oil or jojoba oil, vitamin E, those types of things, is that good to use on your scar? And is there a certain period of time that it's only effective?
So a lot of those products, unfortunately, that are over the counter, like Mederma is another big brand name one, there's not a ton of science behind it.
Really?
So what the studies have actually shown, it's the act of just putting it on is what's helpful, not necessarily what the product or the ingredient is.
So it's like a placebo effect?
Yes, you know, I tell patients, you know, if you have it, go ahead and use it. It's not going to hurt, but they can be kind of pricey, and I definitely wouldn't go buy it. The one product that's been shown to be very helpful with scars, though, is silicone. So they make silicone gel, they do silicone sheets. Yes, the strips, those can be helpful. And that really focuses more on how thick the scar is.
Okay, very interesting. So my main question to you before we started this interview was like a C-section scar. Obviously, you want to wait till you're completely done with babies before you go do that. But everybody has a scar, whether it's something intimate, personal that nobody sees but you, or something that you feel like affects your daily life. So this is a service available. Let's invite everybody out to your spot.
Yes, absolutely. Give us a call, 361-402-9819, and we are located by Spawn South Hospital.
I love it. Well, thank you for joining us and for all that information.